Hey YouTube. Today I realized for the first time that I never talked to you about how I came to a decision to do my surgery straight to tissue expander. So immediate reconstruction, but with tissue expanders. I had a wonderful question today from Waldfee. So first off, thank you so much for subscribing and thank you for listening and for commenting. What she asked me was, how come you did not choose to go mastectomy straight to implant? So first, let me explain what that is. You can actually have a mastectomy and in the mastectomy surgery do immediate reconstruction, put the implant in, get the stitches, right? You're done. I mean, you have to get the tubes, right? There's some follow-up, obviously, make sure you're okay. But that's definitely not the same process as the 6.5, 7 months that it took me. Mastectomy, put in a tissue expander, gradually expand the tissue expander, then go with the tissue expander out and finally get your implants, right? And hope you're done. Rippling, so I'm not done. But the tissue expander approach is a more traditional approach. Like that's how doctors have been doing it for a while. The straight to implant approach is a newer approach, but it can be done by some patients. So let me start with who's a good patient for straight to implant. It is a patient that has a boob that can be a little bit smaller than, that can stand to be a little bit smaller. And here's why. Let me explain this a little bit. So first, let's picture, this is my boob. Here's my skin. I lay my skin over the boob. If I am about to get a mastectomy, chances are my skin is a little bit supple, right? Most of us aren't getting a mastectomy when our boobs first are coming in life. We're usually, in our 30s or 40s or maybe even older. So our skin is a little bit supple, right? So let's say I'm a C cup. Particularly if you've had children, you were maybe a D cup when you were breastfeeding, right? Then you're back to a C cup and your skin has a little bit of give there, right? But if I take the breast out and I have the skin shell that's waiting to receive an implant on the backside. When I refill that, let's talk a little bit about that surgery. It's going to be some swelling, right? It's going to be, your body is going to pump that area full of fluid. So there's going to be extra swelling. Your skin is going to stretch really kind of taut because of the swelling. And because you've had your breast cut out, no matter what you choose for reconstruction, because you've had your breast cut out, your skin has lost some of its blood supply. In fact, a major source of blood supply. So that blood supply usually comes through the ribs and then into the breast, through the breast to the backside of the skin. So quite a bit of the blood supply itself comes through the body out to the skin. There are blood vessels on the surface of your skin. You can obviously see your veins that are on your skin. And there is a thin web of capillaries also on your skin. But it's not enough. Like your skin really thrives with the blood that it gets from your breast. So when you cut that breast out, you have a loose bag of skin with something that certainly can't provide blood supply between the skin and the chest wall. And so your skin has no blood supply except whatever blood supply is contained within the skin itself. So now let's take that skin and if I was a C cup, whatever that equals in implant size. So I believe for me, a C cup would have been 450, 500 cc's, maybe 550. So let's say the doctor cuts out my breast and he goes to put in a 450, 500 cc implant. He takes the breast, so here's back to our example. Breast, skin, take the breast out, fill that skin with an implant same size as what you just cut out. Now, send her home from surgery. What's going to happen is that is going to swell because of the surgery itself, and it's going to get really tight. Well, the problem with that is once that gets tight, no blood supply from the back, only blood supply from the surface. So let me take my skin. I'm just going to squeeze this for a second. So your skin, this is just in a few seconds. I hold my skin really tight, and then I let go, and it's white, and then it fades back, right? Because I've denied it its blood flow, and then I give it back. So how long do we keep swelling after a surgery? Certainly not minutes. It's hours, days, weeks, right, that you have swelling. In fact, it's so bad that you gotta have tubes sticking out the side of your body. So there's no way for them to put in an implant the exact same size as your breasts used to be. So they have to go smaller. So, to make that more clear, the best person to get mastectomy straight to implant, like let's just do this snick, snack, snorum, one surgery, we're going to get this done. The best person for that would be someone who has a rather large breast. So a double D, and you're going to be happy with a nice big full C. Or even smaller, if you wish. Or B, someone whose breast is, the skin has sagged enough that you're like, well, I kind of wanted a breast lift anyway. So that you have enough skin that it can be loose around the implant. The whole point is that you cannot have skin that's stretched taut around the implant that you're about to have put in. I'm no doctor, so please ask your doctor about these things. But basically that's this story that I got from the doctor. And I said, yeah, I'm a C, and I want you to get me back to what I used to be. So I need to be a C or better when I come out of this. And he said, then I'm not going to be able to put in an implant straight away that is that same size. And I said, I'm not willing to go a small B or even a regular B. I would like to be at least my C size. So I had to go with the tissue expander so that he could gradually get me to that place where my skin was stretched. So if you guys remember back to when I first came out of surgery, I had mastectomy and the tissue expanders were put in, and they were filled with 250 cc's of air. Now, not every surgeon does that. Most of the time they do get filled with saline, and eventually I did have saline put into my tissue expanders. But in my case, I came out of surgery, just had my boobs cut out, tissue expanders were in there, 250 cc's of air, which is an A cup-ish on my body. Maybe a small A, I don't know. You can go back and see the videos, but kind of small. But that gave my body a chance to swell and still allow the skin to live. And then the blood vessels themselves, your blood vessels are amazing. They do regrow. They reroute themselves. They build extra blood supply. They're like, hey, we're having some problems here. Need more oxygen. Bring in some more lines, right? And they build new blood vessels. So that does happen over time. It doesn't happen in hours. It takes days and weeks and months. And so after a month, he put in some more air. And then after another month, he put in some more air. I think at the 2-month mark is when I finally got saline. So the second part to that is, can your skin withstand the weight of the implant you're about to get put in? So let's say I have double D's, but I'm going to be happy with a nice big full C. But then the other thing he has to consider is how much blood supply will the cup of your breast get. And so what I mean by that is, let me stand up here. So under my breast, right here, is the weight of the implant, right? So as you consider that this amount of blood that could have come from this skin below here, it's cut off. There is no blood flow passing through the place where he just cut all of the blood supply, right? There's all those blood vessels that used to be there, he cut all the way through the entire skin. So any of the capillaries and blood vessels that used to exist from the low part of my ribs can't provide blood supply to the bottom half of my breast. So the only blood supply that can get to the bottom part of my breast is coming from above. And so how much blood supply can you get there? And what's the weight? Now we're back to the implant itself. If I went mastectomy straight to implant, the implant is in my body, not necessarily tacked against my chest wall, so it's just sitting in there. And so it's going to sit and gravity's going to pull it down. And so when that happens, how much weight is going to be stretching that skin at the bottom of your breast? And is it enough? Will there be enough oxygen for that as well? So all those are the things that the doctor would consider. In my case, I said I'm absolutely unsatisfied with being smaller than I am today. I want to look as close as I can to my old self. And so I said I'm opting for the tissue expander surgery. So thank you again, Waldfee, for asking me the question. I really appreciate that. Thank you all so much for subscribing and for keeping this conversation going. I do appreciate every last one of you, and I try to get back to you usually in the same day. I will talk to you guys again soon. We can talk a little bit more about these here ripples. Still there, getting worse. So subscribe if you want to hear more. And otherwise, we'll see you guys next time.